Good day, everybody. Welcome to this edition of my video newsletter. And before we get started, I just want to thank everybody for tuning into a couple of the previous ones. I'm very pleased at the number of people that are watching the videos. I'm trying to make them short and informative so that you don't have to spend a whole lot of time on them. So I hope you're enjoying them and continue to enjoy the ones that are coming up. Today's I want to talk a little bit about my definition of good. Remember in my last video, we talked about the three-line theory of back pain. This is the lecture that I give often in my office, and a lot of you, I know, have seen it, and I've explained it to you. After the last video, though, I did get a few letters or emails rather, asking about the concept of my good. I had said that it's my good is what we're looking for here. So today I want to talk a little bit about that good and how it pertains to this whole three-line theory and a number of other topics that we're going to be talking about in the future. So when we talk about good, for sure, we're talking about the absence of symptoms. Good means no pain, no stiffness, no achiness, no stiffness when you get up from sitting, no stiffness after you get out of the car on a long car ride, no morning stiffness, no catches, twinges, no symptoms. But there's more to it than that, and this is where it gets to be a little sneaky, and people don't realize the consequences. And that has to do with function. I want to see things working the way they were designed to work. Every joint in the body has a very specific movement pattern. It's built and designed to work in a specific way. When that stops working, then we get into trouble. So what I'm looking for is a normal functioning spine, and that's has nothing to do with symptoms, as you'll see. So this was a diagram that I used a few years ago and many years previous to that when I gave my lectures and I had my office lectures and things. And it shows that when the body starts to break down, you'll notice at the bottom of this diagram is where symptoms are. When the body starts to malfunction, when the systems break down, and it doesn't matter whether it's spinal problems or internal problems, once the system starts breaking down and starts malfunctioning, that disease process starts. And then the symptoms will start showing up. And let me use a couple of examples. We all know that when people are diagnosed with cancer, they go to their doctor usually with a symptom, and they get that unfortunate diagnosis that you've got cancer, whether it be in the kidneys, the liver, the pancreas, whatever it is. But you know full well that that problem had been developing for a long time prior to the symptoms showing up. Heart disease, for example. If I were to drop dead right in the middle of this presentation, we know that heart problem didn't just develop right now. That heart problem had been developing for over a period of time without symptoms until the point where all of a sudden it started developing symptoms. So there's a whole lot going on in the body long before the symptoms show up. And symptoms, unfortunately, are not the best way of figuring out what's going on. The unfortunate part is that's usually what brings us to our family doctors or our doctors first is the symptoms. And oftentimes we find out that there's something more serious going on, and those symptoms are merely a projection of something that had been going on for a long time. Modern medicine has always been symptom oriented. They've still to this day, there are a few tests out there that they've tried running, trying to pick up problems long before the symptoms go. Colonoscopies, endoscopies, various different heart examinations and things. They are trying, but still we're a very symptom oriented population. So symptoms are not necessarily the only sign, or the absence of symptoms are not the only signs of my being good. When it comes to back problems, when we start talking about these, I want to eliminate a couple of them. back problems can occur from doing something really stupid, real heavy lifting, lifting something that you shouldn't have been lifting, and those are accident oriented. So a normal back could be develop a back problem simply from doing something as silly as heavy lifting, or obviously slips and falls. And I'm not talking about those types of problems. Those fall into a total different category. What I'm talking about are ones that people come into my office and I ask them, well, how did this thing start? Oh, gee, doc, I don't know. I just woke up with it. I've been fine. And then this morning I just woke up with the problem. Or, geez, doc, I just bent down to pick something up off the floor. So it's those types of problems that I want to deal with. When I see those types of individuals coming in, I always ask them, well, what had you been doing in the days prior to it? Because there is where the answer lies. It's you couldn't possibly have slept any differently than you'd slept before. You couldn't have slept in a position that you hadn't done before. Certainly bending over to pick something up shouldn't have hurt your back. So obviously there was something going on prior to it. And oftentimes people will claim that there's not. There's nothing there. But when you question them, there's always something that they were doing different that set them up for that overnight or that special movement. And that has to do with how the muscles in the spine are functioning. Okay. All the muscle systems in the back, neck, middle back, doesn't make any difference. They work in pairs, okay? Side to side, there's a pair of muscles on each side of the spine. There's a pair of muscles that work together front to back, all right? And normally those muscles work together. When one tightens up for a certain movement, the other one has to shorten up a little bit. There's a very coordinated movement to all the spinal joints in the back and neck areas. And those have to be working perfectly balanced. When you get an imbalanced system, all right, like this diagram over here where it's on the right hand side, you see one muscle has gotten very tight and the other muscle is underactive, meaning it's just not working as well. It's gotten weak. That situation puts an undue stress on that particular joint. That joint isn't working normally, it's malfunctioning. That malfunction is a significant problem. Here's a diagram that I've used a lot in the past as well. We go to the very top where it says muscle tension. So if you're doing an activity or do something during the day that those muscles don't like, and the muscles get tight, and you see it a lot in upper back problems, middle back problems, but oftentimes in lower as well. The muscles just get tight from overworking or overexerting. That muscle tension produces a buildup of lactic acid. Now, lactic acid is the waste products of muscle contraction. When a muscle contracts and relaxes, there's a byproduct produced called lactic acid. Now, this lactic acid is just as it says. It's a mild acid. It doesn't damage anything, but it irritates the muscles, okay? And it causes those muscles to all of a sudden even get tighter and oftentimes go into spasm. So that buildup of lactic acid normally goes away through the normal, all right, strengthening and weakening of the muscles, of the contraction and the relaxation of those muscles, usually pumps that acid out of the system. But if the muscle is tight and there's muscle tension, that lactic acid has a tendency to build up in the muscles. And it produces a symptom that produces that burning sensation that you get in the muscles after you've overworked them. When you've run for the first time in any period of time, you get that burning sensation in the leg muscles. Those are muscles that are gotten over tense, and there's a buildup of lactic acid in them. So once that muscle goes into spasm, it starts to gum up the workings of the joints, and so we start to develop a joint malfunction. Over time, that joint malfunction produces, and it says subluxation concept, and that's a concept that I don't want to spend a lot of time talking to because it's a very complex. It involves inflammation, swelling, but the key thing is that's the beginning of that disease process going on in the joints, and then it develops even more muscle tension, and it just keeps going around and around and around and around. So what causes that buildup of tension and what causes those joints to start malfunctioning, whereas you're getting one side's tight, one side's weak? Well, one of the more common one is this head forward posture. On the left, you see a nice straight normal posture, and on the left rather, you see a nice normal posture. Excuse me. On the right, you see a head forward posture. Now, on that right posture, all the muscles on the back, running from the shoulder blade up into the neck, are all put under undue tension compared to the ones on the front. The muscles have to stay tight in order to support the head. If those muscles were gone, the head would simply fall forward. So those muscles located at the back of the head, neck, and upper back are constantly under stress and pulling at the joints in the back. So that forward head posture is significant. When you have that forward head posture, the head moves forward, shifting the center of gravity. To compensate, the upper body drifts backwards. So now, by having that head forward, you're also affecting the middle back, all right, where you develop a bit of a hump or a slouching appearance in that middle back. And then to compensate for this upper body shift, the hips and pelvis tip forward. So that forward head position can be the cause of not only the head and neck problems, but also all the way down into the low back. So that type of posture is definitely stressful on the joints. One of the areas that we see very commonly in our offices are people with upper back and neck tension problems from sitting at a computer all day long. That's literally what they're doing is they're sitting in a head forward position, and those back muscles are constantly under stress trying to hold up the head throughout long periods of time during the day. So stress itself, that type of stress that I like to talk about is the physical stress, can produce the neck pain, the shoulder pain, elbow, hip, lower back, wrists. That type of physical stress on muscles can produce all kinds of joint pain. Curvatures of the spine, all right, will start producing stress on the joints because of the difference of the musculature side to side. On the left is a scoliotic spine compared to the nice normal straight spine that we see on the right hand side. People talk about scoliosis. There are basically two types of scoliosis. The idiopathic scoliosis that we see on the right-hand side here is a type of scoliosis that you see develop in young children, it's a type of scoliosis that even to this day they don't understand where it comes from. Everything else is normal with the exception of all of a sudden there's this great big bend in the spine. And it usually affects, you start to see it in young children, 13, 14 years of age, and primarily in young girls. So it's one that, I don't know how many people remember the old days of the Milwaukee brace. There was a big leather brace that they used to strap on kids trying to force that curve to come out of there. An idiopathic scoliosis is a real nightmare from everybody's standpoint because it's not easy, if at all, to correct. There's various different degrees, and if it gets so bad and there's such a big curve to it, you're talking about major surgery and rods put into the spine. And fortunately, we don't see too many of those, but it is a type of scoliosis. The other type of scoliosis, which is by far and away most common, and I see in my office all the time, is a postural scoliosis. And that curvature arises from the fact of something being crooked in the pelvis and the hips. One side is lower than the other side. In this diagram, you can see where the pelvis on the left-hand side is short and compared to the right. The left hip is short compared to the right hip. That whole tilting of the pelvis causes the spine to curvature. This is a postural scoliosis, and I see tons of them in my office. And the trick is obviously to figure out what's causing that tilting. So with that tilting, I see so much of it, and one of the common reasons I see through it is the malfunctioning of the actual pelvic joints. I see so much of it and I treat so much of it, and it's been a real fascination of mine for many, many, many years. To the point where I actually wrote a book and a workbook, and I've got DVDs, and just finished up with a 4-module course that I've got out on the market right now. So I spent a lot of time on this type of postural pelvic tilt and its effects on the spine and making curvatures in the spine. So what you need to know is that the symptoms are merely the tip of the iceberg. The causes of those symptoms is what we need to try to find. And chiropractors know how to do that. Well, some, I guess, well, I don't want to say some, that's not fair. But most chiropractors should be able to come up and figure out what the cause of this back pain is. And what they're looking for is, when someone comes into my office, the symptoms obviously are important. I mean, I listen to what your complaints are and where the pain is coming from. But in the big picture, the symptom is really quite irrelevant. I need to find out what's causing the symptom. Where is it coming from? Why is it coming from there? And that all has to do with function and the fact that something is malfunctioning in the back. And it has been doing so for quite a long period of time. So this idea of good includes not only the symptoms, but it includes the function. All right, is the back functioning normally? And a good chiropractor is able to figure that out. We put you through a myriad of physical tests, orthopedic tests, move you around, go through ranges of motion. We figure out where the cause is, and it has nothing to do with the symptoms. All right. So when you look at good from that standpoint, when you look at function, it leads into a whole other area of interest. And what we're going to do next, well, I always like to throw this one in here, definition of insanity, doing the same things over and over the same way and expecting different results. So if you're having trouble with reoccurring or chronic back problems, then you need to do something different. You need to look at it differently. You can't just keep thinking it's going out, or going in and out, and that's not what's going on. Something underlying is forcing it to keep kicking out and producing symptoms. So you need to try to do something else. So what that leads to, all right, is when you have a malfunctioning spine, whether it's got symptoms or not, something is starting to wear and tear. And this gets us into the next topic, which should be of great interest to a lot of people. And that has to do with the degenerating process and what happens to those joints in the spine when they are malfunctioning. So stuff is going on in your back all the time if it's malfunctioning. Something is wearing and tearing. And that's what you need to be concerned about as far as I'm concerned. All right. I'll tell you a little story that started me off on this tangent about maintenance and looking for function rather than just worrying about symptoms. Years ago, I had a friend of mine who was coming into me off and on for treatment of a back problem. And one day I finally decided, well, let's send you for x-rays and maybe we better take a look in there. So I did, and when I got the x-rays done and looked at them, we noticed that there was severe degeneration of the L5 disc and some moderate degeneration of the L4 disc. And he said to me, well, geez, like, why is that happening? I've been coming to you for years. Well, yeah, you sort of been coming to me for years. You come in when it's hurting, you get a couple of adjustments, and you're feeling better, and then out you go. And then you come back in 2 months later, hurting again. All right, a couple of adjustments and away you go. So you keep getting treated and adjusted based on your symptoms rather than looking for what was causing those symptoms to keep reoccurring and keep coming back. That's what I mean by the symptoms are really irrelevant. They're not irrelevant to the patient coming in or to you coming into my office. You want to get the pain out of there, and I understand that. But there's more to the picture. That state of okay that we talked about is causing big problems inside. It caused the degeneration that I saw in his back. At that point, I decided that's it. I'm no longer going to be focusing on symptom treatment. I'm going to be doing function and working, making sure that people's spines and hips and lower back are working prime. That is the key to the way I like to practice. That leads to all kinds of maintenance issues, and people don't want to be doing maintenance. And we'll spend some time talking about maintenance and why I think it's that important. But it all revolves around this issue of taking care of the function during that okay state. All right. So the next video I want to send out to you is one that's already been prepared. It's part of I developed it as part of my course content, and it's a video in which we will deal with disc degeneration. We'll deal about the disc, or we'll deal with the disc itself. What is a protrusion? What is a, what's degeneration look like? We'll look at MRIs and X-rays and what they show, and the relationship between MRIs and X-rays and disc degeneration, and basically everything you'll need to know about what disc problems are and how they developed. All right, and it's an important concept, and most people are interested in that because oh yeah, you have a deteriorated disc. Well, what is a deteriorated disc? What does that mean? What does a disc bulge or a disc protrusion mean to you? You know, doctor says to you, oh yeah, you got a disc a disc herniation here. You're going to need surgery. Well, you better understand what this is all about with these disc things before you start jumping into anything that's as drastic as having surgery done on it. So at any rate, that's going to come about in our next video, and it's already prepared and go out. So I'll probably try to send that one out even as early as next week. But it leads us into a whole myriad of different topics as a result of that. So hopefully you understand this concept of good as it applies now to okay. It's not just the absence of symptoms. It's the absence of malfunction. It has to be working properly. It cannot be malfunctioning in order to be my definition of good. Okay, so we'll leave it at that, and you can wait till the next one, and then we'll talk about the discs and that whole process of wear and tear and how you get into a situation where you've got disc degeneration and herniations and disc bulges and protrusions and all sorts of other things happening in your spine. So until then, have a great day, and we'll see you at the next video.